The Omicron BA.2 variant of COVID-19 is now confirmed to be in Jamaica. The Ministry of Health and Wellness says in a statement on Wednesday that the latest gene sequencing results from the National Influenza Center at the University Hospital of the West Indies found that 2 samples tested positive for the newer BA.2 variant. 89 samples were tested between January 1 and March 4, which 98.9% of them were Omicron variants and 1.1% was the Delta variant. Of the Omicron samples, 2 of the 88, or 2.3%, were the BA.2 variant and 97.7% were BA.1 variants. According to the World Health Organization, the BA.2 variant is the dominant strain globally, with the type of illness associated with this variant being similar to the BA.1. Chief Medical Officer Dr. Jacqueline Mackenzie is cautioning that while the majority of cases appeared to be mild, this is a highly transmissible variant, which may result in an increase in the number of quoted 19 cases. This puts persons with comorbidities at greater risk of contracting the virus and developing severe illness, while persons who have mild or no symptoms may be at risk of developing the long COVID. Dr. Mackenzie is urging members of the public to continue practicing infection prevention and control measures, including the wearing of masks, hand washing, physical distancing, and staying home if you are sick. Persons are also encouraged to visit any of the 200 vaccination centers across the island to give themselves greater protection from the worst effects of COVID-19.